Hi, I'm Sean and I'm here today with Dr. Joseph Arisco in order to ask some questions that are commonly presented when someone is seeking psychiatric treatment. First thing I'd like to know is, why do people develop mental illness?
These disorders are complex in their origin. The majority of patients I take care of have health problems of some kind, especially those that are chronic and painful that cannot be escaped. That is a tremendous strain on your nervous system. The second factor that is commonly observed is heredity. Many people that have psychiatric illness also can recognize other people in their family that have the same thing. What's wrong with mother and dad is generally what's wrong with you. The substance abuse issue is controversial. If you have substance abuse, it's often not known whether that's a cause or an effect, but nevertheless it plays a role in your mental health. Trauma is often the trigger to cause people to come to the doctor, whether that's spiritual, physical, emotional, sexual, or other forms of trauma. The relationships in which you reside are often factors in whether they are past relationships, present relationships, or the relationships that you will have with others in the future play a substantial role in how you feel emotionally. And the last is neurochemical. While these are hard to understand, that's what my job is, to try to explain to you what does that mean if I have something wrong with how my brain works.
Okay, and so how long does mental illness last?
Everyone wishes that it would be over with quickly, and so do I. But the reality is these disorders often are recurrent phenomena which happen on and off through your life. You may notice it at puberty, it goes quiet, and then somewhere between 15 and 25 you have the episodes over and over. So our goal is for each time it happens to you to bother and disturb you less, and certainly be less frightening.
Will other doctors hear about my treatment?
The only way they will is if with your permission. I'd be glad to communicate with anybody you've trusted to your care. I would say to you that you don't want other doctors that treat you to be ignorant of what I may be used to help you get well. So I would say that it's best to have a treatment team, if you want to call them that, so that we all work together for your best interest.
Okay, and how would having a diagnosis affect me in the future?
We have to have a name for what's wrong. It is required. And it's also scientific. When you have a diagnosis, that is the basis on which we will proceed. So even though the concern may be others may see that as a stigma against you from now on, our goal is that you overcome the illness, whatever the diagnosis is.
Okay. How will seeking treatment affect my family?
Your family, whether you know it or not, is fully aware that something's wrong. So our goal is for you to pick whoever you consider the most trustworthy, one or two people, and have them join us so we may work together for you to get well.
And then, is there anything that you'd like to tell anyone who might be viewing this video today?
Yes, Sean. I really pledge to my patients that I will care for you with 21st century techniques which are delivered safely, efficiently, effectively, ethically, and privately. A well-informed patient and their family are best served with full explanation of the diagnosis, treatment options, and what to expect. Mental disorders often damage how a person sees themselves. So our goal will be to preserve your self-confidence.